My second lecture for today, hip preservation versus replacement, when to preserve and when to replace. These are very important questions. Very often we see patients in our outpatient clinic coming in with already critical hip joints but asking for preservation surgery. Evaluation of the hip joint is very complex, especially to decide between preservation and total hip arthroplasty. Several parameters need to be considered: history, symptoms, age, MRI, radiographs, physical examination, and the patient expectations. This is a very simple algorithm that we already studied in medical school, but this always needs to be considered when you evaluate patients. Only by taking the history and symptoms of the patients you are able to come to the right diagnosis, at least in many cases. So if the patient is complaining of a long duration of symptoms, increasing restriction of range of movement, increasing pain with activities, and after activities complaining of ongoing pain for hours and maybe days, and if the patient already is taking lots of anti-inflammatory medications, so usually this hip is already critical and probably not good enough anymore for preservation surgery. There are several demographic risk factors for osteoarthritis of the hip joint. It's the gender, age, and the body mass index. Actually, the female gender is a risk for worse results. It has been shown by several studies that women less frequently return to previous activity, and also that the revision rates for females are higher. Age is also a strong factor correlated with worse results. So it has been shown by several studies that there is a higher failure rate with higher age concerning both complications and rehabilitation. The Bern group, for example, has reported a smaller survival rate for higher age after 30 years of periacetabular osteotomies. Body mass index is a risk factor, but it's not only a higher BMI, it's also a smaller BMI, which is a risk factor for worse results. It is helpful to hear what kind of pain the patient is reporting. If the pain is mostly dull, patient is getting worse with more activity, and if the pain is persisting after activity, those aspects are indicators for a hip joint which is already in a worse condition and probably more eligible for total hip arthroplasty. Meanwhile, there are already several studies that has been showing that a greater duration of symptoms is a significant risk factor for less favorable results after preservation surgery. Patient expectations, this is a very important factor. So if the expectations of the patients are very high, especially if they require being able to do sports, and if the hip joint is already in a critical condition, it's very difficult to meet those expectations. The importance of the physical examination is always underestimated. So already the inspection of the patient in the room is important. When you notice that the patient has difficulties to take off shoes and socks, when the patient is limping, when the pelvic is moving during walking, when you see that, then those signs are already important findings that show you that the hip is probably not good enough anymore for hip preservation surgery. You need to look for restricted range of movement if your physical examination shows that the patient already has a flexion contracture, or if evaluation of rotation shows that rotation is significantly reduced. If the patient already has an external rotation contracture, usually this hip is not good enough anymore for a preservation surgery. Coming to X-rays and MRIs. Looking at X-rays, of course, you know that we need to check the grade of osteoarthritis. If we have a tennis or Kellgren-Lawrence grade 2 and more, usually the hip is not good enough anymore for preservation surgery. This has been nicely shown for the survival rate of periacetabular osteotomies by the Byrne group. And also for arthroscopies, several studies have shown that frequently there is no benefit of arthroscopic surgery when osteoarthritis is grade 2 and higher. Marc Philippon has shown that if the joint space width is less than 2 millimeters, usually it does not make sense to perform preservation surgery. From my experience, joint congruency is the more important factor. So if the joint is incongruent, the results are less favorable, and this also has shown for rotational acetabular osteotomy by Japanese colleagues. However, incongruency can be easily overlooked. You need to look carefully. From this case, you would say the joint space looks good and congruent. However, when you do additional radiographs, such as the false profile view here in this case, you notice that the posterior medial joint space is significantly reduced, and this hip joint is not good enough anymore for preservation surgery. MRI is very important. Do not accept standard or bad MRIs, such as shown here on the left side. So especially if the hip joint is in a critical condition, you need to have high resolution MRIs. In selected cases, it is of course very helpful to obtain such high resolution MR arthrograms, and with those pictures you're really able to assess the amount and depth of cartilage damage. When you look at the MRI, always check for bony edema and subchondral cysts. If edema is advanced, if edema is at the head, and if you have extended and maybe central subchondral cyst, usually this hip is gone. This is what you see here. You see on the left side full thickness cartilage defects. You see edemas on the femoral head and also on the acetabular side. So this hip is not good enough anymore for preservation surgery. Take home message: a critical hip is always an individual puzzle. A precise preoperative evaluation is always necessary. Tennis 2 only in very selective cases. Always try to discuss patient expectations. The higher the expectations, the more difficult it is to meet the expectations, especially if the condition of the hip joint is already critical. You always need to treat the primary disorder, the cause. That's always crucial. And usually, from my experience, prophylactic surgery, especially in such cases, is not justified. I would like to take the opportunity to invite you to our Munich hip meeting this year in November. The meeting will be all virtual. We will have arthroscopic surgeries, open surgeries, PAOs, total hip arthroplasties, real-life surgeries. It would be a pleasure to welcome you to this meeting in November. Thank you so much for your attention.